Hello everyone! I was assigned to discuss to you about the methods of contraception na magagamit nating mga lalaki at lalo na sa mga babae in the future. So ano nga ba ang purpose ng methods of contraception? Unang-una na dyan is to prevent pregnancy, lalo na laganap ang maagang pagbubuntis ng mga kabataan dito sa Pilipinas. Around 74,000 of teenagers got pregnant last year 2021 in the age between 10 to 19 years of old. Pangalawa ay magagamit din ito ng mga nanay na di na pinapayagang magbuntis sa kadahilanan na hindi na kakayanin sa susunod nilang panganganak o iniiwasan ang genetic disorder in the lineage of their family. Pangatlo is to achieve the number of children they want. Either gusto mo ng dalawa or isa lang, or maybe 5 kung kaya pa. That's what we call planned pregnancy o planadong pagbubuntis. So let's start. Now we have called the natural methods of contraception. So why it is called natural method of contraception? Because we're not going to use any synthetic drug or any device that is inserted in the reproductive parts, or hindi rin tayo mag-i-inject ng mga gamot or any chemical kung saan mang parte ng ating katawan. So natural methods, there are different ways to do this in natural basis. So why is it called a natural method? Number one, it's inexpensive. Hindi daw magastos. Wala kang babayaran na mahal buwan-buwan. Lalo na, hindi pa ito kasama sa budget ninyong mag-asawa or mag-jowa. Or sana all. Number two, it is not hazardous to the health because it's organic. You just have to know when is your ovulation. Next is of course, it is approved by some religions. So since it's natural, you're not going to use anything, then it is accepted by the other religion. So now, when we talk about natural methods, the first thing you should know is when or what are the signs that a woman is ovulating. When we say ovulation, this is the release of mature egg cell from the ovary going to the fallopian tube, specifically at the ampulla. During the period of menstrual cycle, nangyayari ang ovulation. The first natural methods of contraception, of course, is the completely effective way to prevent pregnancy is, of course, the abstinence. Abstinence is the most effective natural method as individuals refrain from sexual intercourse that may lead to pregnancy. Iniiwasan ang pagbubuntis sa pamamagitan ng pag-iwas sa iba't ibang sexual activity. It also has 0% fail rate. O diba, safe na safe ka? However, most people find it hard to comply to use this method, so only few people use abstinence. Karamihan sa mga lalaki ngayon di na marunong mag-intay. Pag ginusto, gusto talaga. Bahala na si Batman, sabi nila. From the word abstinent, it means not being sexually active with anyone right now or abstaining from sexual activity. It is most effective way to avoid STI or the sexually transmitted infection. Next is the calendar method, also called the rhythm method, kasi you are going to lag the rhythm of your menstruation. Individual abstain from sexual activities during the days that the woman is fertile. Kung gagamit ka ng calendar method, dapat inaalam ng mga babae kung kailan ka fertile or hindi fertile para maiwasang mabuntis. Alam naman natin na ang mga babae isang beses lang nag-ovulate. It entails withholding from coitus during the days that a woman is fertile. According to the menstrual cycle, the woman is most likely to conceive 3 to 4 days before and after ovulation. At sa mga araw na yan, hindi ka gagawa ng sexual activity. The woman should record her menstrual cycle for 6 months to calculate the woman's safe days to prevent conception. So, kinakailangan tignan muna ninyo itong tinatawag na ninyong cycle ng mga babae. Once hindi mo kalkulado yung cycle na yan, mahihirapan kang gumamit ng calendar method. Next, we have the basal body temperature. The basal body temperature, also known as BBT, this will indicate the woman's temperature at rest before the day of ovulation and during ovulation. BVT falls at 0.5 degree Fahrenheit. It increases a full degree because of progesterone and maintains its level throughout the menstrual cycle. The woman must record her temperature every morning before any activity. A slight decrease in the basal body temperature followed by a gradual increase in the basal body temperature can be a sign that a woman has ovulated. Next is the cervical mucus method. To change the cervical mucus during ovulation is the basis for this method. So titingnan natin ninyo pala yung mga mucus na nakalagay or mapipil nyo sa inyong mga genitalia para malaman natin if sang stage na kayo. During ovulation, the cervical mucus is coiffous, thin and watery during ovulation. It also exhibits the property of spin barque, wherein it can be stretched up until at least 1 inch and slippery. So slippery ang mucus ng babae, dapat daw i-avoid ang coitus during those days to prevent conception. Kapag ang cervical mucus ay dry and thick or ay not fertile, so pwede kayo mag-coitus dyan. Kapag creamy or sticky, hindi pa rin fertile yon. And kung cloudy or stretchy, semi-fertile na siya. Dahil na-stretch na siya, so unsafe na yan. If it is watery, stretchy like egg white, fertile na siya. Meron din dito yung 1-month cycle, itong bilog. Yung sa menstrual ay dry days naman, walang lalabas na mga mucus. So because you're experiencing menstruation, you are probably infertile on that time up to 9th day from the start of your menstruation. First day of wet days is the 10th day, so up to this 17, the ovulation, and then up to 20 days fertile ka pa din dyan. Hanggang pumasok sa 21st day hanggang 30th day na another dry days. Magiging infertile, so pwede kayo dyan. So base yun sa pagkakaintindi ko. Next is the symptothermal method. Basically a combination of the basal body temperature method and the cervical mucus method. The woman records her temperature every morning and also takes note of changes in her cervical mucus. So si symptothermal ay ilalag niya or ililista niya ang kanyang temperature and also observe the cervical mucus na lalabas sa kanyang genitalia. She should abstain from coitus activity 3 days after a rise in her temperature or on the 4th day after the peak of mucus change. Next is the ovulation detection method. Uses an over-the-counter kit that requires the urine sample of the woman. This kit can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. So this is the example of ovulation detection. Ito ang magde-detect whether you are undergo the ovulation period, pero meron din tayong mga application na pwedeng i-download sa Play Store na pwedeng i-record ang inyong mga activity, mga daily experiences, emotion, and etc. Na marami na ngayon magagamit para ma-check ang inyong ovulation. So the last natural methods of contraception is the coitus interruptus, which is the oldest methods that prevents conception. The couple still goes on the sexual activity, but the man withdraws before he ejaculates, imitating the semen outside of the female reproductive organ, which lessens the likelihood of fertilization o yung sinasabi nilang withdrawal. The disadvantage of this method is the pre-ejaculation fluid that contains a few semen that may cause fertilization. May tinatawag tayong pre-ejaculation na hindi makokontain ng mga lalaki na lalabas pa rin sa kanilang mga genitalia na hindi mo namamalayan na magkukos ng fertilization pa rin. So that's all for the natural method of contraception. Ulitin ko lang, meron tayong abstinence, calendar method, basal body temperature, cervical mucus method, the symptothermal method, the ovulation detection, and the last is the coitus interruptus. So those are the things na mga natural. Hindi gumagamit ng chemical or kung ano mang ini-inject para mag-birth control. Next type of methods of contraception is the artificial, kung saan gumagamit na dito ng mga pills, gamot na ini-inject sa inyong katawan at or pinapasok sa inyong mga reproductive system. First, we have the oral contraception. The oral contraceptives, also known as the pill, contains synthetic estrogen and progesterone. Estrogen suppresses the follicle-stimulating hormones or FSH and the luteinizing hormone, which is the LH, to prevent ovulation. So ang estrogen, pinipigilan niya yung pag-fertilize nung sperm nung lalaki. It also decreased the permeability of the cervical mucus to limit the sperms to access at the ova. And then, sinasabi na ang oral contraceptives ay parang yung naglalak nung sperm, hindi pinapapasok dun sa loob ng ova ng babae. Pinipigilan na pumasok. Ganon. So next is the transdermal patch. The patch contains both estrogen and progesterone. The woman must apply one patch every week for 3 weeks of the following areas: upper outer arm, upper torso, abdomen, buttocks. In the 4th week, no patch should be applied because the menstrual flow would then occur. So sinabi dito na pag 4th week na, tatanggalin mo na siya kasi magme-mens ka na dyan. And then yung itsura niya is parang salompas lang na tinatapal. Next is the vaginal ring. The vaginal ring surrounds the cervix and releases estrogen and progesterone. It is inserted and remains inside the woman's body for 3 weeks. Then it is removed in the 4th week as the menstrual flow would occur. So sinasabi na ipapasok daw dun sa ari ng babae yung ring na yan, nakikita nyo yung hawak ng babae, I think. And then tatanggalin mo siya in the 4th weeks kasi magme-mens ka na dyan. Like dun sa transdermal patch na tinatanggal din sa 4th week kasi magme-mens na. Next is the subdermal implants. Subdermal implants are two rod-like inserted under the skin of the female during her menses or on the 7th day of her menstruation to make sure that she will not get pregnant. The implants are made up with ethinogestrel, desogestrel, and progestin. It can be helpful to 3 to 5 years. So, pupunta ka ng health, sa isang health expert. Sila dapat yung maglalagay niyan. Hindi ka pwedeng maglagay niyan basta-basta. Kasi hindi pa basta-basta ang paglagay ng transdermal implants. Kailangan expert talaga yung maglalagay. Next is the hormonal injection. A hormonal injection contains medroxyprogesterone, and is usually given once every 12 weeks or exactly 3 months intramuscularly. The injection causes change in the endometrium and cervical mucus and can help ovulation. So, yung nakikita nyo sa picture is the example of the hormonal injection o yung tinatawag nilang Depo-Provera. May kilala akong gumagamit ng ganito, yung kapitbahay namin. So next is the intrauterine device, or also known as IUD. An intrauterine device is a small T-shaped object containing progesterone that is inserted into the uterus via the female reproductive organ. The IUD creates the inflammatory condition in the uterus to prevent the development of the zygote. It is the only fitted by a physician and inserted after the woman's menstrual flow. This device can be effective for 5 to 7 years. So, isa rin ito sa mga physician yung naglalagay. Hindi ka pwedeng maglagay nito. Tingnan nyo, sobrang hirap siguro ilagay niyan. Kita niyo sa picture na mahirap talagang ilagay kasi naka-T-shape siya kasi yung pinakang ulo ng tiyo nakalagay sa taas. Next is the chemical barriers. Chemical barriers such as spermicide, vaginal gels and creams, and glycerin. Films are used to cause the death of sperms before they can enter the cervix. So, parang nilalagyan nila ng takip yung daan papuntang fallopian tube ng babae para hindi raw makapasok yung sperms ng lalaki. It also lowers the pH level of the female reproductive organ so it will not be conducive to the sperm. So sinasabi nga na pag nagtagal yung sperm ng lalaki sa labas ng fallopian tube, mamamatay lahat yung mga sperm na yon. However, chemical barriers cannot prevent sexually transmitted disease. So ayun nga, hindi naman niya kahit may takip siya, papuntang fallopian tube ng babae, hindi naman niya mapipigilan yung mga sexually transmitted disease na galing dun sa lalaki o dun sa may sakit. Next is the diaphragm. The diaphragm is a circular rubber disc that fits the cervix and should be placed before the sexual intercourse. It prevents the sperm to enter the female reproductive organ. The diaphragms work better when it's used together with spermicide. This device is placed only by a physician and should stay in 6 hours after sexual activity. So, kamukha lang siya ng chemical barriers na parang takip lang din siya. Pero mas maliit ito tingnan. And then, kagaya ng intrauterine device, IUD, yung physician din yung maglalagay nito at 6 na oras lang yung itatagal. So, magsasayang ka lang ng oras sa paglagay ng ganito, sa pagpalagay. Tapos, after ng 6 hours, tatanggalin na rin. So, kaunti lang yung gumagamit siguro ng diaphragm. So, next is the cervical cup. This is made of soft rubber and fitted on the rim of the cervix. It is shaped like thimble with a thin rim and could stay in place for not more than 48 hours. So, kagaya din ng chemical barriers at saka ng diaphragm, yung para ng paggamit niya. Yung pantakip lang din siya. And then, sa time naman, kagaya nung sa diaphragm na 6 hours lang yung tagal, ito naman 48 hours. And then, ang alam ko, physician lang din daw dapat yung maglagay ng ganito. Yung cervical cup, nagbablocks din siya ng sperm from entering cervix. Next is ang alam ng lahat, the male condoms. The male condoms are made of latex rubber or synthetic rubber sheet that acts as a barrier. Male condoms are used to trap the sperm during ejaculation and have an ideal fail rate of 2%, but a typical rate of 15% is due to breakage. When undamaged and worn properly, it can prevent the transmission of STD. So, alam ko namang alam ninyo ang male condoms kasi wag pa inosente, nilalagay siya pag naka-erect na yung ari ng lalaki. And then, sinasabi na mayroon din siyang fail rate kasi if sobrang gamit na gamit siguro yung condom na yan, napupunit. So, kung merong condom ang lalaki, meron din syempre ang mga babae. The female condom works similarly as the male condoms, but is pre-lubricated with spermicide and the inner ring covers the cervix to keep the sperm from entering the uterus. So, ang kinaibahan lang sa condom ng babae, meron na siyang spermicide at saka may lubricant na daw siya. And then, sa itsura niya, merong 2 rings sa babae. Yung isang ring sa labas, yung isang ring sa loob nilalagay. And then, ang paglagay daw niyan, yung parang uunahin mong ilagay yung sa labas bago ipasok yung sa loob. So this is the last artificial method, which is the surgical method. Nag-undergo na siya ng surgery. Ito yung sa lalaki, yung vasectomy. Vasectomy, in this surgical method, a small incision is made on each side of the scrotum. The vas deferens is then tied, cut, or plug to block the passage of sperm. So, pinuputol yung vas deferens, tapos itatali siya or naka yung parang lalagyan ng bra para hindi daw dumaan yung sperm. The male patient is advised to use as a backup contraceptive method during 2 negative sperm count results are recorded because of the sperm could remain viable in the vas deferens for 6 months. So, kahit naputol na yung vas deferens, syempre may natitira pa rin sperm cell dun sa pinakang litid na yung kadugtong ng vas deferens. And then, active pa siya. Active pa yung mga sperm niyan. And then, kailangan magdalawang negative sperm count daw muna yung result niya bago ka hindi gumamit ng ibang, kahit wala ka nang gamiting ibang methods of contraception. Kailangan 2 negative sperm count ka muna. So, hindi ko na isama pala yung sa babae. Meron din ng babae, which is the ligation. Yung sa ligation naman is yung fallopian tube ata yung pinuputol sa fallopian tube para daw hindi na magbuntis yung mga babae. Pinuputol na yung fallopian tube. So, that's all. And thank you. And good luck to the quiz. Sobrang haba niya. Jayo.